Let's discuss about an autoimmune disease which is called as CRUST, that is limited systemic sclerosis. This CRUST, in this condition, we often see the severe form of Raynaud's phenomena is seen. We know that Raynaud's phenomena is nothing but the distal ischemia occurring whenever the patient is subjected to the cold temperatures. That is, critical limb ischemia is more severe form is seen in these people, that is limited systemic sclerosis. In this condition, we find the conditions like CRUST, that is C is for calcinosis cutis, R is Raynaud's phenomena, E is esophagitis, S is sclerodactyly, T is for telangiectasias. So these all group of conditions are seen in this condition CRUST. The autoantibody seen in this condition is the anti-centromere antibody. Let's look into the clinical features and also skin manifestations seen in the patients of limited systemic sclerosis, that is CRUST syndrome. This CRUST is a limited systemic sclerosis or Scleroderma. It is an autoimmune connective tissue disorder. In this condition, more long-standing Raynaud's phenomena is seen, and the history often gives the history of months to years, and severe form of critical limb ischemia is seen in these patients. Let's evaluate this CRUST. C is meant by calcinosis cutis, R is a Raynaud's phenomena, E is a esophagitis, S is a sclerodactyly, T is a telangiectasia. And the autoantibodies seen in the patients of CRUST are the anti-centromere antibody, and these patients are also positive for anti-nuclear antibody, but most specific antibody is the anti-centromere antibody. And the complications seen in these patients are the pulmonary artery hypertension, whereas in case of diffuse type of multiple systemic sclerosis, interstitial lung disease is a complication, whereas in case of limited systemic sclerosis, pulmonary artery hypertension is the most common complication seen. And also skin involvement is seen in these patients, and skin involvement is limited to fingers, distal to elbows, and also mild arthralgia is also seen in these patients. As already explained, esophagitis will be seen, and watermelon stomach is seen in these patients. Let's look into the investigations which help in the diagnosis of systemic sclerosis. X-ray is found to be the most important diagnosis, useful. X-ray, HRCT, pulmonary function test, in order to estimate the lung involvement, and diffusion lung capacity is also measured, and restrictive type of disease is seen in patients of systemic sclerosis. And upper GI endoscopy is also useful. As I said, the patient also suffers with esophagitis and watermelon stomach, hence we also need to do the upper GI endoscopy. And let's discuss about the treatment plan. And no single drug is found to be useful in treating the patient, but in order to treat the lung manifestations like interstitial lung disease, we use steroids. In order to treat the interstitial lung disease, lung manifestations, then we need to use the drugs like steroids, cyclophosphamide, mycophenolate mofetil, these are the drugs which are used in treating the interstitial lung disease. Even the steroids and methotrexate are used in treating the arthritis condition. In this condition, we find arthritis, lung manifestations, skin manifestations, and all these conditions will be seen. And the complication which is seen in these patients is the most common complication is the pulmonary artery hypertension. This is seen in case of limited systemic sclerosis, whereas in case of diffuse systemic sclerosis, interstitial lung disease is the most common complication, but in case of limited systemic sclerosis, PAH, that is pulmonary artery hypertension, is more common. And this is in brief about the condition CRUST, that is which is part of limited systemic sclerosis. And thank you for watching.